Hello, I'm Dr. David Zweiback, internal medicine in Ballacoma, Pennsylvania, talking to you about GI topics. All right, so we refer irritable bowel. Irritable bowel is a condition where there's a hyperreactivity in the muscular walls of usually the small bowel, and that will cause diarrhea in many individuals. But it can also cause constipation as well, and they're treated differently depending on which is the result. Constipation is treated one way, and diarrhea is treated with other kinds of medications. Also dietary modification as well. There are different causes of bleeding in the intestinal or GI tract, and depending on where the blood is forming will determine what it looks like when it comes out the other end. If there is bleeding happening in the rectum or the anus, you will see bright red blood. You'll also potentially see the source. If it's in the distal or most furthest reaches of the small or the large intestine, it also, if it's sitting in there a little bit longer, can turn into a maroonish color. It also tends to be a slightly thicker, pasty consistency. When blood is coming from the stomach, it has quite a long time to make the transit from the stomach all the way down to the anus. So when that comes out the other end, it will be a dark blood appearance. The only time you can have bright red blood in the stomach is if you're having a very rapid transit bleed, which would be very serious and probably debilitating.